Do you frequently feel like your heart pains sometimes? Or maybe you're always tired, even after a full night's sleep? What if your belly feels full quickly when eating, almost like your stomach is being squished? These might not just be normal issues. They could be signs that something's happening deep inside your bone marrow. That's where blood cells are made. In a rare condition called Primary Myelofibrosis (PMF, the factory that makes your blood goes haywire. Your bone marrow, instead of producing healthy blood cells, starts turning into scar tissue. This means fewer red blood cells, which carry oxygen, fewer platelets for clotting, and even strange-looking white blood cells. It's not common, but when it happens, it slowly affects how your whole body works. Think of it like a car engine slowly filling with mud. It just can't run smoothly anymore. So what causes this bone marrow mud buildup? That's a great question. With primary myelofibrosis, doctors often say, we don't know exactly why it starts. But we do know it's not from germs or catching it from someone else. It's not like a cold. Instead, it's caused by mistakes in the DNA of your blood-making cells, like a typo in a recipe that keeps getting copied. One common typo happens in a gene called JAK2, and others in CALR or MPL. These genes normally help your body make blood cells in the right amounts. But when they're broken, they make more signals nonstop. The bone marrow overreacts and builds too much fibrous scar-like tissue. It's not your fault. This isn't caused by diet, stress, or lifestyle. It usually happens in people over 50, and it starts silently, long before symptoms show. Now imagine you're at dinner, and after just a few bites you feel full, like your belly is pushing against your ribs. That might be your spleen working overtime. In PMF, your spleen tries to help your damaged bone marrow by making blood cells. But it swells up, sometimes as big as a grapefruit, which causes that early fullness. Other signs, you feel weak and dizzy because of low red blood cells. That's anemia. You might bruise easily or bleed longer from small cuts, low platelets. Some people get itchy after a warm shower, strange, right? That's because too many white blood cells release histamine, like in allergies. Night sweats, fever, and bone pain, all possible. But here's the tricky part. Some people have no symptoms at first. The disease can sneak in quietly, like a slow leak in a tire. How do doctors find out if it's PMF? Let's say you're tired all the time, and your doctor feels your belly during a checkup. If they say your spleen is larger than normal, that's a red flag. Then they might order blood tests. Your blood might show strange shaped red cells, like teardrops and low counts. But to be sure, you might need a bone marrow biopsy, a small sample taken from your hip bone. It sounds scary, but it helps see if scar tissue is forming. They may also test your genes for those typos, JAK2, CALR. Once diagnosed, treatment isn't about curing it completely. It's about managing it. For mild cases, doctors just watch closely. For worse ones, medicines like ruxolitinib can shrink the spleen and reduce symptoms. Some people get blood transfusions if anemia is bad. In younger, healthier patients, a stem cell transplant, replacing faulty bone marrow with healthy donor cells, might be the only cure, but it's risky. It's like swapping the broken engine for a new one, powerful, but not for everyone. Can you prevent primary myelofibrosis? That's tricky, since it's caused by random DNA changes, not by germs, smoking, or diet. There's no vaccine or lifestyle fix that stops it completely. You can't avoid it like the flu. But, and this is important, you can catch it early. How? By listening to your body. If you're often tired, bruise easily, or feel full too fast, don't just brush it off. Say to your doctor, hey, something feels off. Regular checkups, especially if you're over 50, can help spot clues early. Think of it like car maintenance. You can't prevent every engine problem, but regular checks help you fix issues before they cause a breakdown. The good news, science is moving fast. New drugs are being tested that don't just treat symptoms, but target the bad cells more precisely. For example, momelotinib, a new JAK inhibitor, was approved recently to help with anemia. A huge win, since anemia is a major problem in PMF. Researchers are also testing combo therapies, using two drugs together to work better than one alone. There's even exciting work in gene editing, like CRISPR, which might one day fix the faulty JAK2 gene itself. Imagine repairing the typo in the recipe instead of just managing the bad cake. Clinical trials are ongoing, giving hope to patients. While we're not there yet, every year gets us closer to turning PMF from a life-altering